There are basically four principles that help give us an architecture. And I think it's important that people move away from being a slave of methods and identify that it doesn't matter who your population is, athlete or sedentary, doesn't matter your environment, if you're at a gym or a clinic or virtual, it doesn't matter if you see young people or old people. The most important thing is not to be a slave of methods and to have a certain tethering to a GPS. And for us, we've simplified things so that you can apply this from any background with any person. The first principle is reassurance, and that's how we build trust. We want to hear people's story, and we want to be passionate about it so we can know what their goals are and what their concerns and fears and worries are. And so reassurance is the first thing. Hurt doesn't necessarily equal harm, and activity isn't dangerous. And in this way, we're really challenging the status quo. The second principle that builds on top of reassurance is reactivation. And these twin principles really help take us forward towards the third principle, which is resilience. And you recently had 𝐓𝐚𝐥𝐤, a person I admire a lot, on your podcast. And he talks about how rehab is training in the presence of injury. And that is how we build resilience so that people can not just spring back, but spring forward, which takes us to our fourth principle, which is risk mitigation. So we know there's not just one way. Problems are complex, and hearing people's story, reassuring them, teaching them that not every hurt equals harm and that the motion is the lotion through reactivation, by giving them a positive experience with movement, helps to begin the process. And then, of course, we need to do a more robust rehabilitation where we're not managing people away from load. And that brings in the resilience. And ultimately, because everybody is different, to mitigate risk is sort of the path of uncertainty and humility. We can't prevent problems. Problems will come, but we want people to feel that they don't have to give up their activities. And when people feel that hurt equals harm and activity is dangerous, they think that they've worn out, that they've hit an expiration date, or their career is over, or that their identity is gone. And we want to reverse engineer all that so that people's health span lasts their lifespan. So risk mitigation as our fourth principle really brings it all together so that we can train people for life, for being 70, for being 80, for being functional at 90.